Hey everyone, welcome back to my channel Psych Circles. Today, we're diving into a topic that's incredibly important for parents, educators, and anyone interested in mental health. Understanding the differences and similarities between ADHD, Attention Deficit/Hyperactivity Disorder, and ASD, Autism Spectrum Disorder. Both of these neurodevelopmental disorders can affect behavior, communication, and learning, but they are distinct conditions with their own sets of characteristics and treatment approaches. By the end of this video, you'll have a clearer understanding of ADHD and ASD, how they overlap, and how they differ. If you find this content helpful, don't forget to like, subscribe, and hit the bell icon for more insights on mental health and developmental disorders. Life can be challenging, especially when dealing with conditions like ADHD and ASD. These neurodevelopmental differences affect how people process information and interact with the world. Understanding these conditions is crucial for supporting individuals and families. ADHD stands for Attention Deficit Hyperactivity Disorder. It's a neurodevelopmental disorder that affects both children and adults. It often shows up in childhood and can continue into adulthood. Symptoms can vary widely from person to person. People with ADHD might have trouble focusing, sitting still, or controlling impulsive behaviors. These challenges can impact their daily lives, making simple tasks seem monumental. Imagine trying to focus on a conversation while a dozen butterflies flutter around your head. This constant distraction can be exhausting. That's what it can feel like for someone with ADHD. The world can seem like a whirlwind of distractions, making it hard to stay on task. Their brains are wired differently, making it hard to filter distractions and regulate attention. This neurological difference means they process information in unique ways. This doesn't mean they can't focus on anything. In fact, they might hyper-focus on things they enjoy or find interesting, sometimes to the exclusion of everything else. However, everyday tasks can feel overwhelming. Simple activities like organizing, following instructions, or completing chores can be particularly challenging. Patience and understanding are key. Supporting someone with ADHD involves recognizing their unique strengths and challenges, and offering help without judgment. Many find that therapy, medication, and support groups can make a significant difference. These resources provide strategies to manage symptoms and improve quality of life. Tools like planners, reminders, and structured routines can also help individuals with ADHD stay organized and on track. With the right support and understanding, people with ADHD can thrive and lead fulfilling lives. It's all about finding what works best for them. ADHD is not a one-size-fits-all diagnosis. There are different types, each with unique characteristics. Some individuals primarily struggle with inattention. They might daydream, miss details, or have trouble organizing tasks. Others might be predominantly hyperactive impulsive. They fidget, talk excessively, and act without thinking. Many individuals experience a combination of both inattentive and hyperactive impulsive symptoms. It's important to remember that these are just categories. Every person with ADHD experiences it uniquely. Understanding the different types helps tailor support strategies to individual needs. The exact causes of ADHD are still being researched, but genetics and brain differences likely play a role. There's no cure for ADHD, but there are effective treatments to manage symptoms. Medications like stimulants can help improve focus and reduce hyperactivity. Therapy such as behavioral therapy or cognitive behavioral therapy teaches coping mechanisms and organizational skills. Lifestyle changes like regular exercise and a balanced diet can also make a difference. Remember, managing ADHD is a journey, not a race. With the right support, individuals with ADHD can thrive. Section 5. Autism Spectrum Disorder, a different way of thinking. Autism Spectrum Disorder, or ASD, is a complex neurodevelopmental condition that affects communication, social interaction, and behavior. It is a lifelong condition that manifests in early childhood, often before the age of 3, and continues throughout a person's life. Autism Spectrum Disorder, or ASD, is a complex neurodevelopmental condition that affects communication, social interaction, and behavior. Children with ASD may struggle to express themselves verbally or non-verbally, making it challenging to connect with others. Imagine seeing the world through a different lens, where social cues and sensory experiences are processed differently. Everyday sounds, lights, and textures might feel overwhelming or even painful. This sensory processing difference can make ordinary environments feel chaotic and stressful. That's what it can be like for someone with ASD. navigating social situations can be particularly challenging, as understanding and responding to social cues doesn't come naturally. This can lead to feelings of isolation and frustration. People with ASD might have difficulty with social interactions, understanding nonverbal cues, or engaging in imaginative play. They may prefer structured routines and find comfort in predictability, which can make spontaneous activities daunting. They might have repetitive behaviors or intense interests. These behaviors, such as hand flapping or fixating on specific topics, can be a way to self-soothe or make sense of their environment. It's important to remember that ASD is a spectrum. This means that the condition presents itself in a wide range of ways, and no two individuals with ASD are exactly alike. Abilities and challenges vary greatly from person to person. Some individuals may have exceptional skills in areas like mathematics, music, or art, while others may require significant support in daily living. Understanding and acceptance are key to supporting those with ASD, as they navigate a world that often doesn't cater to their unique way of thinking. Section 6. Navigating the spectrum symptoms of ASD. ASD can manifest in various ways. Some individuals might be nonverbal, while others might have advanced language skills. Social challenges are common, but some individuals with ASD might have strong social connections within their comfort zone. Sensory sensitivities are also prevalent. Everyday sounds, lights, or textures might feel overwhelming. Imagine feeling a gentle breeze as a harsh wind or hearing a whisper as a shout. That's the reality for some individuals with ASD. Understanding these sensitivities is crucial for creating supportive environments. Section 7. Unraveling the mysteries, causes, and management of ASD. The exact causes of ASD are complex and still being studied. Genetics, environmental factors, and brain development likely play a role. Researchers are continuously exploring how these elements interact to influence the development of ASD. There's no cure for ASD, but understanding and managing it can significantly improve the quality of life for those affected. Early intervention and ongoing support are crucial. Therapies like speech therapy, occupational therapy, and social skills training can help individuals develop essential communication, social, and life skills. These therapies are tailored to meet the unique needs of each individual, ensuring personalized care. Medications might be used to address specific symptoms like anxiety or hyperactivity. It's important to work closely with healthcare providers to determine the best treatment plans. Creating a structured and predictable environment can also be beneficial. Consistency and routine help individuals with ASD feel more secure and less anxious. Remember, the goal is to support individuals with ASD in reaching their full potential. This involves not only therapies and medications, but also fostering an inclusive and understanding community. Community support groups and inclusive education play a vital role in this process. They provide a network of understanding and resources that can make a significant difference. Families also need support and guidance. Parental training programs can equip families with the skills and knowledge to better support their loved ones with ASD. Technological aids such as apps and tools designed for ASD management can also be incredibly helpful. These tools can assist with communication, organization, and daily routines. Celebrating the achievements of individuals with ASD is important. Success stories in autism management highlight the potential and capabilities of those on the spectrum, inspiring others and promoting a positive outlook. Advocacy for autism awareness is crucial. Promoting understanding and acceptance of ASD helps create a more inclusive society where everyone can thrive. As we look to the future, ongoing research holds hope for advancements in ASD treatment and management. With continued effort and dedication, we can make strides in unraveling the mysteries of autism and improving the lives of those affected. Section 8. Overlapping and distinct comparing ADHD and ASD. While ADHD and ASD are distinct conditions, they share some overlapping features. Both can affect attention, social skills, and emotional regulation. Individuals with either condition might experience anxiety, depression, or learning difficulties. However, there are key differences. ADHD primarily affects attention and hyperactivity, while ASD impacts social communication and behavior more broadly. Individuals with ASD often have sensory sensitivities, which are less common in ADHD. Understanding these similarities and differences is crucial for accurate diagnosis and tailored support. Section 9. Diagnosis. Recognizing the signs and seeking help. Early diagnosis and intervention are crucial for both ADHD and ASD. If you notice persistent challenges with attention, hyperactivity, social skills, communication, or behavior, it's essential to consult with a healthcare professional. They can conduct assessments, gather information, and make an informed diagnosis. Diagnosis often involves observations, interviews, and standardized tests. It's important to remember that diagnosis is not a label but a starting point for understanding and support. Don't hesitate to seek help. Section 10. Living with ADHD and ASD, Strategies for Success. Living with ADHD or ASD presents unique challenges, but it also comes with strengths and perspectives that enrich the world. Individuals with ADHD often possess creativity, enthusiasm, and a unique way of thinking. Those with ASD might have exceptional focus, attention to detail, and a passion for specific interests. The key is to embrace these strengths while developing strategies to manage challenges. This might involve creating structured routines, breaking down tasks into smaller steps, or using visual aids and reminders. Section 11. The power of support, families, therapists, and communities. Navigating ADHD and ASD is a team effort. Families, therapists, educators, and communities play a vital role in providing support and understanding. Families provide love, acceptance, and a strong foundation. Therapists offer guidance, strategies, and a safe space to process emotions. Educators can adapt learning environments to meet individual needs. Communities can foster inclusivity and acceptance. Together we can create a world where everyone feels supported and empowered to thrive. Section 12. Empathy and awareness. Building a more inclusive world. Building a more inclusive world for individuals with ADHD and ASD starts with empathy and awareness. Educate yourself about these conditions. Challenge stereotypes and misconceptions about them. Treat everyone with respect and understanding, regardless of their differences. Small acts of kindness can make a big difference in someone's life. Listen to individuals with ADHD and ASD and their families. Their voices truly matter. Let's create a world where everyone feels seen, heard, and genuinely valued. Section 13. Sharing the knowledge, spreading understanding and acceptance. Knowledge is power, and sharing that knowledge can change lives. Talk to your friends, family, and colleagues about ADHD and ASD. Share this essay and other reliable resources. Advocate for inclusive policies and practices in schools, workplaces, and communities. Together, we can create a world where neurodiversity is celebrated, and everyone has the opportunity to reach their full potential. Let's spread the word and make a difference.